presentation. Thank you all for joining. Excuse me. All of us, we're very excited to have you here. My name is Chris Parfit, and I am the Interim Director of Community Relations for Ida Culver House Ravenna. And with me today are 6 residents who have volunteered to share their experiences living in a retirement community. As you all know, in late February this year, a call was made to public health officials from a staff member of a nursing facility in Kirkland, Washington, expressing concern for residents and staff who were showing flu-like symptoms, but didn't test positive for the flu. Soon after, the entire country was shaken by the news that COVID-19 was now at our doorstep and posed a threat to all of us, particularly those who were 60 years and older. The media portrayed skilled nursing facilities under the same umbrella as retirement communities. And since then, there has been confusion, concern, and fear related to living in a retirement community during a pandemic. And to clarify, a skilled nursing facility is an inpatient rehabilitation and medical treatment center staffed with trained medical professionals. A retirement community is a residential community or a housing complex, much like an apartment building, designed for older adults who are generally able to care for themselves. These communities often provide meals, activities, and social opportunities. And some retirement communities, such as Ida Culver House Ravenna, also offers assisted living services. And as the community relations person at Ida Culver House Ravenna, I have been talking on the phone with hundreds and hundreds of people about what it's been like to live in a retirement community during COVID. And I can only answer using the stories that I've heard from our residents. And I thought perhaps you all who are members of our audience today would benefit from hearing the answers directly from them. So my panel members, would you please wave so that the audience can see who you are? Hi there. That's great. Now you'll notice that the panel members and I are not wearing masks today, and that's because we're not together. The residents are each in their apartments, and I am in my office. We at Ida Culver House Ravenna, we follow COVID protocol very closely here, and we advocate for everyone to wear the appropriate protective gear, such as masks, and to follow social distancing as directed. We believe it's one of the reasons that our community is currently COVID-free, and that our company, Era Living, has an infection rate of only 0.06% compared to the infection rate of 6% of all of those tested within King County. Now, if that number surprises you at how low our infection rate is, it may have to do with the news reports which have blended cases of retirement communities such as ours with nursing facilities such as the one in Kirkland. And unfortunately, that has resulted in a misperception of how COVID has affected communities, which bear a vastly different model, just as I had explained. Now, I've compiled a list of the most common questions I've received from people that I talk to daily. And I'm going to ask these questions and our panelist members will answer. And once we've finished, we would love for you to type in your questions in the chat box and we will answer those for you. All right, panel members, let's begin. So I'm actually going to start with Jessie. Jessie is a resident and panel member who was diagnosed with COVID-19 in March. And Jessie, you tested positive yet asymptomatic. Can you tell us about this time and what the hardest part of the experience was having COVID?
Well, I was diagnosed with COVID at the very first testing that they did here at Ida Culver. And first of all, I was very surprised because I had no symptoms, absolutely none. But then, you know, thank goodness the Ida Culver staff jumped to the starting gate and took care of everything that was needed. They sent in a special aide to take care of me, brought me with all my meals. The staff were dressed in their PPE equipment, and this took care of all of the details. And I know that there were 2 other residents that also were tested positive, and they took care of all of us, and that was absolutely all they did. And we were definitely confined to our rooms, but you know, everything they could think of to make us more comfortable was done. But it was all very scary, and the very fact that I'm so glad to be here, because being asymptomatic, when I think about where I might have given somebody else the COVID if I'd been out and about, it was good that we were confined to our rooms.
That's great. Thank you, Jesse. How long were you quarantined? And about how many COVID tests did you have before you were considered recovered?
I had 4 COVID tests all done here at Ravenna before the last one came through negative. And that was my way to celebrate April Fool's Day, because that was when I got noticed that my tests were now negative. And so then they were able to relax a little bit the protocol for isolation. At least I could step outside to pick up outside my apartment to pick up the meals when they were delivered and set on a shelf just outside the door. Or even wave at people as they came through, though we all had our masks on.
That's great. Jesse, in terms of frequency of the nursing staff or any staff that were checking in on you, did you feel like you were getting checked enough throughout the pandemic? Did you feel like you were getting your needs taken care of?
I think, yes. You know, while I was positive, they were there. The aides and the help were there at least 3 times a day. They came at the same time. They were delivering meals, which that kept the interactions down between all of us. They were checking on everything. In addition, there were supervisory staff and other staff people that would check in on me occasionally. I even had some phone calls, making sure that I was feeling well or being taken care of. But they were there at least 3 times a day. And as I said, it was the same person all day, which I really appreciated, not thinking that we could see several people.
Yeah, that's great. Jesse, looking back at the experience, would you have rather been somewhere else, like with family or at your own home or in the hospital?
You know, this was the very best place for me to be. This is my home. I have no other home, and I have children that live here, but they were unable to take care of me. And I really feel that this was as good a care as I probably could have gotten in the hospital, because I didn't need some of the detailed equipment and so forth that the hospitals would have.
Great. Jesse, thank you. We appreciate that. I'm going to move on. Yes, thank you. I'm going to move on to some other questions. The next set of questions that I ask are the most common ones that I have received when I've been talking on the phone with people who are interested in moving into our community. This question is one of the most popular ones, and that is, as a resident, what stands out for you about living in a retirement community during a pandemic? What did you appreciate about the experience, and what frustrated you about the experience? Who would like to answer that?
I can speak to that one.
Thank you, Mary.
The thing that stood out to me most was the feeling that I wasn't alone. And I appreciated the positive attitude of everybody on the staff here. The ones who called twice a day to check and make sure we didn't have any symptoms. The people delivering meals are always cheerful. So there was a lot of support from the staff practically. They did shopping for us, they did laundry for us. I even had a couple little chores, watering a little area of pots on the 4th floor. They took care of that. And I have a car, and somebody went down and started my car once so my battery wouldn't die. They arranged for mail and packages to be delivered to the rooms instead of having to go get them. So yes, we had to stay in our rooms, and that was frustrating for a while, but we had all of our needs met. And also I have a cat, and that cat made sure that I got up off the couch many times a day to attend to many needs. And have social things just for fun, the ice cream and the happy hours and birthdays and psych support if you need it. The frustration, of course, was the inability to go outside until they were gradually able to get that back in, and missing family. But even if I was still in my own home, I would have missed my family. And FaceTime isn't so good for young grandchildren. So that was pretty hard. And also the no activities. We have so many wonderful activities here. We can have the swimming excursion once a week. We have card games and movies and lectures, which of course we couldn't have and couldn't get to church or things like that. So, but But those frustrations, I think, were more common to the general populace and not just because I was here.
Great. Thank you, Mary. That's wonderful. The next most common question we get is, were you concerned about catching COVID at any time living in the retirement community? What did the community do to help you stay healthy? Who would like to answer that?
I'm Ruth. I'll answer that.
Thank you, Ruth.
I had the opportunity to work for the 911 system for over 20 years. And in that environment, I learned a very important lesson, and that was teamwork. Work together as a team if you want to win. And that was the business of 911. And I learned it well. And when I moved in here, I had a flashback to that experience. And I knew immediately when the virus hit here that we had to work as a team to win. We knew the enemy, and therefore we knew the rules. And we didn't like the rules, but you had to work together as a team, helping each other. One person alone couldn't give you a win. It had to be all of us. I can give some examples of how that worked here. Number one, the nursing staff from the University of Washington proved to be an excellent neighbor. They were here, they gave us tests, and they got the test results returned to us in a timely manner. That was very comforting to us and to our families. Also, the matter of laundry. There was a time we couldn't do our own laundry, and the director had the staff pick up our laundry, do it, fold it, and return it to us. And the last thing I want to give as an example is the food. The wait staff went from servicing us from the kitchen to the dining room, and they couldn't do that anymore. Instead, they put the food on carts and covered 4 floors of residents, always with a smile. Hardworking group and very much appreciated.
Great, Ruth. Thank you. Did someone else want to answer that question?
I can add a little bit to that. Not much, because that was so well stated. The things they did to keep us healthy, I think we've alluded to a little bit, but the no contact, the wearing of masks, this is, of course, once we're able to get out of our rooms a little bit. And they have an in-house TV channel that does have the lectures on it and has a lot of the exercise things for people to access if they want. And they did extra cleaning in the halls. And I think that kind of reassures when you're out and about that you can touch things and not worry about it too much. And then the 2 times a day calls at the beginning just to check on us. And even still, they do once a day calls, some member of the staff, just to make sure nobody's having any symptoms. So just little things like that, in addition to what Ruth has already mentioned. They're just, no, I really was not worried about catching, and I felt I was in the best place I could be.
Okay, thank you, Mary. Thank you. This next question is also one of our most common ones, and that is, did you feel safe? Did you feel safer in a retirement community than you would have you lived in your own house? And the second part of that question is, what did the community do for you? Who would like to answer that question?
I'd like to answer that.
Eileen, go ahead.
I'm Eileen, and when I think about this question, and I felt how blessed and how thankful I am that I am at Ida Culver. But it also made me think of what would it be like if I was still back in my family home. And the contrast just reinforces in me that I'm in the right place at the right time. I think some of the things have already been mentioned here. Our check-in calls regularly, first twice a day and then once a day to make sure we don't have any of the symptoms. The meals provided, the shopping list we can fill out twice a week so that we don't have to go to the grocery store or the pharmacy or the whatever. The other thing too that no one has mentioned, here at Ida Culver, while we were following the guidelines and were first strictly quarantined, isolated, and now we have a sort of a modification of that. But no one enters this building except staff and residents or people authorized to come in. And even those that come in from outside the community that have a reason to be here, their temperature's taken down at the front lobby, and I don't know what else because I'm not one of them. But it just these little things. We've got two clunky old elevators, but they're very important for us to get up to the third or fourth floor, especially if you've had a knee replacement. We are only asked to have one person in the elevator at a time. This means waiting, which also leads to one of the other things I'll talk about later is what do you do when you're waiting? I think we've also mentioned that we can call for help. We have both can call on our phone, but we have pull cords in two of our important rooms where if we should have a fall or whatever, get to that and pull it, and we immediately have we are answered. They come directly to our room, and they all have keys to get in if our door is locked. So that's a real assurance. I haven't ever had to use it, but I know it's there. And I think, well, who is it that answers the call? And it's somebody from our wellness.
Nice. Eileen, thank you. That's great. Excellent. This next question, I'm actually going to address it directly to Ron. Ron moved in just about 5 or 6 weeks ago. And he moved in knowing that there was a pandemic going on and that he was moving into a retirement community. And Ron, I would like for you to share your experience as to why you did choose to move into our community and how you made that choice.
Okay, this, I was living with my son in a rental house a couple of miles away, and our lease was up August 31st, 2020. So last fall, when I signed up here on the priority wait list, I put down on July or August 2020 for my moving date, and was just thinking ahead to that. There's a good friend of mine who moved in here a couple of years ago, and I saw her every week or two and talked to her frequently. And I think I saw her on March 5th. And that evening she called me and said they had picked up a couple of positive tests on this new virus and they locked everybody down and I wouldn't be able to come in and see her anymore. So this got me thinking, I wonder if that's what I really want to get involved in. So around, I think May, Trish called me up because of my desire on my wait list application that I'd like to move in here around July or August. And we started talking and I expressed a little bit of concern. And I contacted my landlady to see if it would be possible to get an extension on the lease if necessary. She said we could get a month or two, or I could go for a 6-month minimum extension. So my son and I had a lot of talking to do. And I finally looked at the future and I didn't see anything, any guarantee that would be any different in October or in March than it was right now. So I started to just kind of move ahead and, okay, I'm just going to bite the bullet and go ahead with this move. Well, I went ahead and secured a unit, and in July, I started moving a few small things of mine in, and all I had to do was show up in my car, come in, they'd read me temperature, ask me some questions, give me one of those green tags, and I could just load up the hand truck with 3 or 4 boxes. I'd come in, get a squirt of hand sanitizer and rub down the handle on the hand truck and wheel things to my room. And then I'd sign out and go home, and I'd do the same thing a couple of days later. When it came time to move the furniture, they have a small moving company who's all up to date on their procedures and the restrictions. They loaded up my stuff, and they were in here and out in about 45 minutes, and it was all done. And it was very economical, and I'm really glad I went ahead and did it, because here I am in this place. For the first time in 60 years, I don't own a vacuum cleaner. I've got this nice lady that comes in and changes my sheets. She cleans the bathroom and vacuums and dusts and gives me clean towels every week. And I don't have to go to the store for groceries.
Ron,
And
that's
it's
great.
just been really good. I'm glad I did it.
Wonderful. Thank you, Ron. Thank you. That's great. As a next question that we get the most of is, as a resident who stayed at the community, do you regret not leaving to go live with family or someone else? What would you have done differently had you been given the choice? And what will you do differently when the next, well, super virus hits our region? Who would like to answer that?
I'll answer that.
Thank you.
Excuse me. I should not and did not and was not in the homes of my family. They were all working from home, which meant that sometimes they had to leave, go out to the office or to the grocery store. And when they returned to their homes, nobody met them at the door to take their temperature or ask them the questions. And that is as it should be. I miss seeing them. I miss not being able to play with their dogs and their cats. But what I needed to do was be right here. I knew I was safe. They knew I was safe. They conducted themselves as adults. And so they were fine also, but they didn't need me there. I needed to be right here. And if we find ourselves in a similar situation, again, which I describe as an emergency situation, I know what to do. Follow the rules and stay secure.
So glad you were on the 911 dispatch for 20 years. Another common question that we get is, currently you cannot gather, right? You're not allowed to gather in groups due to the possible transmission. So that keeps us from gathering in classes, in our exercising, group discussions, watching movies together, or visiting socially. And I'm curious, how have you been staying engaged and active during this time? Who would like to answer that? Eileen.
Okay, here we go. And how did I get those needs met when I couldn't go to a class or go out to a movie or go to a concert or all the many things, or go to church? Well, lo and behold, there's such a thing as called a computer. And on a computer, there's such a thing called Zoom, in which we are all experiencing right now. And I was sort of, when I first came to Ida Culver, technically impaired. But I have learned, I have gained new skills, and through Zoom and telephone and television, I have been able to contact friends. I've been able to go to church and worship. I've been able to serve on committees. They even have a book study group here at Ida Culver where the residents are meeting together on Zoom. So that was really a key thing for me. The other thing is Ida Culver has its own TV channel. And throughout the week, we can look at movies, we can do exercises, there can be music, there's just all kinds of things. And our social worker has wonderful chats about how to keep your emotional life together during this rather challenging time. Also, the other thing that was so important to me is that we could have family visits when we reached a certain point in the guidelines outside. The other thing that was helpful to me was the garden and time for morning meditation. So I've got a full life here, and I'm thankful for it.
Nice. Thank you, Eileen. Thank you. Did someone else want to answer that question?
Well, I just would add, and I think it's been wonderful that we've had our garden out back, and Eileen is one of our top gardeners, and she certainly has made it beautiful. As soon as we were able, many of us go out to walk and get exercise and fresh air whenever it happens. And sometimes we're able to visit in small groups out there, and that's been always very good. And I would say that when the visitors came, and I have family with special needs, that the staff were able to meet those needs so that my family could enjoy their visits. And that too was a very special thing and made my family feel as welcome as anybody else. Plus there's reading, and you could get books from the library, and the Life Enrichment group is always providing activities for us to do and encouraging us to do special things and have new imports and things, and we're doing like an international day a week, and they give us a little bit of information about each country, and we have something for lunch that signifies what that country is. So all the people here just are really trying to work together as much as possible to give us things to do and keep us interested and involved.
That's great. Thank you, Jessie. Thank you. Another common question that we get is, what was the food situation like? You were not allowed to go to the dining room to eat. So how did you stay nourished and fed? And what stands out to you about eating in your apartment?
Well, I'll answer that question.
All right. Thank you, Jessie.
And as quickly as possible, the kitchen staff, our dining room staff, changed emphasis, and they began fixing meals that could be delivered to all of us. And they gave us limited choices. For each meal, we had 2 choices, and we got to make the choice, and they brought it to us. And as far as what was nutritious, they planned nutritious meals, and it was just our choices as to whether or not we could eat choices. For many of us, we have refrigerators in our apartments, and if there were other things that we wanted, either they could do shopping. When they did shopping for us, they would bring us things, or sometimes our family members would bring us things to add to what was coming from the kitchen. It was really disappointing. It's really challenging to eat in your room by yourself with no company. Meals are a social time, but I made it, and you just made the best that you could. I know I've talked to other residents who have, maybe don't have tables or things, and it's more challenging, but I think everybody's figured out a way that we could eat in our rooms, and are looking forward to the day that we can start eating in the dining room again.
Great, Jessie, and I hear that's going to be soon. So
Can't be soon enough.
Can't be soon enough. I understand. Thank you, Jessie. This next question, I'm going to address it to both Ron and Mary, and the reason that I'm picking the 2 of them is Mary moved in right before COVID hit. So she moved from her house into Ida Culver House Ravenna. And then, as you heard, Ron moved in on his own right after the bulk of the COVID shutdown. And so this is another one of our most common questions. It's almost up there in the top. So that's why I've saved it for closer to the end. But I'd like to hear from both of you. Ron, we'll hear from you first. But the question is, people have voiced big concern about giving up their freedoms if they moved into a retirement community. What freedoms do you feel like you have given up or have not given up when you moved into Ida Culver House Ravenna?
Okay, this is an example. Last week, I had a doctor appointment Monday. I just go to the desk and sign out. I have my car in the parking garage right down the hall. And I went to the appointment. I was back in about 2.5 hours and signed in. Another time I made an appointment to go to my bank and do sign up for a new type of a distribution, cash distribution thing. And I did the same thing. I had the freedom just to get in my car and go. I happened to need some stockings, so I stopped on the way home at TJ Maxx and practiced social distancing and wore the mask and bought the socks, and I went out and sanitized my hands and came back, and And that can be done any time that you've got something outside you need to do or want to do. There's really no restrictions as long as you follow the rules. You just let people know where you are and practice all the safety measures. You're fine. We can't hang around in the hall talking to people like we used to, or watch movies in the dining room or something. But we can go outside. It's pouring rain today. I don't think I would, but we can go outside and walk around in the garden. And even they've got a few chairs out there outdoors, some of them under cover. And sometimes we'll sit down with 3 or 4 people 6 or 8 feet apart with masks on and able to talk outdoors. So I really haven't felt that I've been a captive of any sort.
Great, thank you, Ron. Mary, what would you like to add, having just moved in?
Well, I was here for a couple of months before, almost a couple months before we went into the lockdown. So I got used to all the wonderful things that are around here. The things we've talked about before, the movies, lectures, the eating in the dining room, and just visiting with people. And I missed all of that, but I didn't think of it as not having freedom. I thought of it as enhanced safety. And as soon as things kind of lightened up and we were able to do a few more things, I, like Ron, do have a car, and I was, I love the garden, but I don't like to walk in the garden because there's a lot of up and down, and I don't do well with that. So I talked to the then director and said I wanted to go out and walk in the neighborhood where there's a flat area. And also I wanted to get in my car and drive, and she allowed that was okay at that point. So now I can drive over. My daughter and son-in-law and grandchildren live in Ballard, so I was able to drive over there. I don't go into their home, and I don't get within about 10 feet of them, but I can watch the kids play, and I can talk to them and just have our distance visits kind of thing. And I can go to appointments as I need to and take the cat to the vet occasionally, that kind of thing. So I feel like, again, when we were pretty locked down, it was for safety, and I could understand it, even though of course I didn't like it, but I understood it. And we have to act as a team. We've heard that before, and it's true. But now I feel no restrictions on my freedom at all. I just feel that I do live in a community, and when I leave, I sign out and then sign back in, so people don't wonder where I am and that kind of stuff. So it's almost like living in an apartment, but not quite, because of we feel a responsibility to the other people living here.
Thank you, Mary. Did anyone else who doesn't have a car want to answer that question? Eileen?
Yes, I gave up my car 2 years ago before the COVID. But even then, I found that we have personal transportation. It's one of the things I don't think we have shared with everybody. 3 days a week, we can sign up for personal transportation. And there's a modest fee that goes on our monthly billing statement. And we use it mostly to go to doctors, dentists, and very important appointments. But I found that was a lifesaver for me. It enabled me to give up my car, which I then saved up all the money I gained from selling the car insurance and maintenance. I could just get all kinds of transportation going with the money that I saved. So that was on the plus. But I'll tell you, there are times when I wanted to get some plants for the garden, and I couldn't jump in my car and run out to the nursery and bring back just the right plants I wanted. But you know, again, staff helped. At one time before the virus, they could load us up in our bus. We had a little bus, and drive us over to the nursery, and we could all go out and buy all the plants we wanted, get back on the bus and back in. So even now with the guidelines, we do have personal transportation just twice a week to go to doctors and dentists and important things. So you don't have to have a car to have freedom. You don't have to have a car to get the things you really need.
That's great. Thank you, Eileen. Thank you very much. Thank you so much. Oh, go ahead.
I was gonna say, if you want anything more about people without a car, this is Jessie. I went to Seattle a little bit.
Of course.
I moved to Seattle 14 years ago, left my car behind in Montana deliberately, and I've managed on public transportation all of these years. And we do have public transportation we can still use. Right now we have to be very circumspect about when and how we use it because of the potential for COVID, but with your mask and everything. And, you know, so there are several different varieties of that. Plus I've had friends that have helped me out. So there are many ways you can get out and about if you need to.
That's great, Jessie. Thank you. Yes, Ruth.
Chris, I have one point to add to this. Excuse me. I have the services of King County Access. I qualify because I can't drive my car, which I miss a lot. But because I have macular degeneration, the Washington State Patrol does not want me driving. Therefore,
none of us want you driving.
So I qualify for King County Access, and the governor put us in phase 1, and that meant that I could call them and book a trip to go to a doctor's office or something like that. Those buses are marvelous, inexpensive, clean, carefully driven, and I very much appreciate the fact that we can, if we qualify, use that service.
Great. Ruth, thank you for bringing that up. I appreciate that. Panelists, thank you so much for sharing your stories and your perspective. And I'd like to take this moment to hear from our audience. Do our audience members have questions? If you do, please type them in the chat box and we will answer them as they come up. We'll wait just a moment here. Also, if you don't, if you called in, you can always, let's see. If you've called in, you can call in if you want, or you can email your questions to me. My name is Chris Parfit, and it's chris.parfit@eraliving.com. It's the same email address that you have from the email you received on how to get to this Zoom call. Or you can give us a call at 206-523-7315. Again, that's 206-523-7315. And we'll just check the chat box really quick here. I think. Give me just a moment. Not sure. Stephanie, do you see any questions in the chat?
Nothing so far.
Okay. All right. Well, while people might be typing, I do have something to share with one of our other residents who was going to be on the panel but could not be due to a doctor's appointment. Her name's Peggy Monroe, and she wanted to answer one of the questions about feeling safer in a retirement community if you'd lived in your own house or lived someplace else. And she said, if I were living in my own house, I would have to go out to buy groceries and make other purchases. Partly because of my age, I don't order things online. I could have been exposed to the virus multiple times, and since I'm in that vulnerable age group, and I have an autoimmune disease, this would have been risky in the extreme. But here at Ida Culver House, the food is brought to my door, the staff do all my essential shopping, and my car is parked in an enclosed and safe parking garage. I get a daily call to check about symptoms. And when we had residents who were positive with COVID, we were asked to remain in our apartments to avoid infection. And those residents were placed in isolation and treated with supportive measures until they recovered. Thank you for that, Peggy. All right, I do see from Terry. Terry, you asked, the Ida Culver House Ravenna video talks about the 4 pillars of response. It says if residents leave for higher risk activities, they may be asked to quarantine. What are higher risk activities and to quarantine for how long? That's a great question, Terry. Thank you. And higher risk activities would be flying to someplace and going through the airport. going out to and staying in the hospital, if you had a fall or for any reason that you needed to go to a hospital, those would be the top 2 high-risk activities. Or going with your family or a friend out for several nights, spending the night at a hotel or at an Airbnb or at a friend's house. Those are all high-risk activities because it puts you in risk of being infected with the virus out into the public and being with transmission, with a higher risk of transmission. Quarantine comes in 2 ways. First of all, when you come back from those activities, your temperature is taken, you're asked all the questions, but you also take an on-site COVID test, and you have to wait about 3 days. And that waiting time, you are then quarantined in your apartment. You're not allowed to leave your apartment until you receive your test results back. If your test results are negative, you're fine. If your test results are positive, you have the choice of quarantining in your apartment or going someplace else, such as a hospital. I hope that answers your question, Terry. Does anyone else have a question from our audience? We have about 10 minutes left. One of the other things that Peggy wrote, I'll share this other question. In regards to residents who stayed at the community instead of leaving to go live with family or to stay somewhere else, what would you have done differently, or what will you do differently when a super virus comes into our region again? And she said, I would not have dreamed of bringing additional risk and the burden of my care to my children and their families. In their turn, they were immensely happy to know that I was living in a safe place. I will remain here at Ida Culver House Ravenna, well looked after, when things calm down, and also when the other virus descends upon us. And then she also wanted to answer one last one, and that is, what do you do to stay engaged? Because we're unable to get together for classes. And she wrote, I have a stationary bike in my apartment, so that helps with the exercise. Our staff have arranged for various interest groups to meet via Zoom, and those residents who don't have computers could have the loan of a device to get on Zoom. We have an in-house movie channel and TV channel for concerts, lectures, classes, and travel narratives. And as the protocol loosened, we could meet with masks on and maintain social distancing, and it was so much fun to return to interacting with another live human. She says she loves to read, and the staff arranged for library deliveries and returns, and they also have devised crafts for us to do. They brought us ice cream and made festive alcoholic drinks for our weekly happy hour. While we're waiting to see if any of our audience members have other questions, I'm going to open this question up to our panel. Is there anything else that you want to share with our audience about what it's been like to live here during the pandemic? Eileen.
I would like to take a quick look at before the epidemic and after.
Okay.
One of the things we haven't been able to share with you because we haven't been able to do it is our community of a wonderful relationship between residents and staff. And the interaction is hard to describe. They not only take care of us well, but cheerfully. And we all use each other's first names. The other thing is we do have our resident association where we meet once a month, listen to reports, listen from management, what's happening here in our community, and lots of other things. We celebrate all the holidays, birthdays, and all the holidays together. And we have little subgroups. We have, one time we read plays together. And what a kick that was. We each took the different part of the play. We do creative crafts. I taught beading, and we had a lot of fun with that. So it's not going to be forever, and we still have a beautiful community together. We just have to follow guidelines right now. But hope we've been helpful to all of you out there in the audience.
That's great, Eileen. Thank you. We do have another question from the audience, and that was a great answer. Thank you, Eileen. Terry asks again, in the Ida Culver House Ravenna video, it also talks about testing. The targeted testing includes screen residents daily. What does this daily screening include? Anyone? Ron, why don't you answer that one since you know that one the best out of all the residents.
Yeah, every day, at some point during the day, we get a call. One of the staff people I use gets punished by having to sit by the phone and talk to all of us. And they just call up and say, do you have any new symptoms today? Are you feeling good? And we let them know. And I try to come up with some comical way to say, nope, nothing new. Just feeling pretty good. And that's it. But every day we get that call. And they just want to check and make sure somebody doesn't feel weak or have a temperature or came up with a cough or something. So I feel really comfortable that they're really on top of all of us.
That's great. Something I want to share to the audience is we screen in various ways. If you're not a resident or whenever you come into the building, the front desk has you take your temperature. So we take your temperature from your forehead and that's recorded. You then get a little green sticker to put onto your person here that demonstrates that you've passed the screening. You also have to, we used to ask the questions, but now it's on a piece of paper so we can record them. You answer the questions regarding where you've been, if you have any types of symptoms of COVID, and have you been to an airport, have you been in touch with anyone who has COVID, or have you been to another retirement community or a skilled nursing facility. So there's a list of questions on that questionnaire and you have to answer those and you have to pass those in order to get this green sticker. And then as for the residents in each one of their apartments, they have a button that they need to push in the morning. And if they don't push that button, they get a phone call. If they don't pick up the phone, then one of our nursing staff or one of our front desk staff will come and knock on your door. If you don't answer your door, we will let ourselves in to check on you to make sure you are okay. That's part of our daily practice, no matter with COVID or without COVID. But with COVID, all residents get a phone call like Ron was talking about that asks, how are you feeling today? What are your symptoms? Are you different in your baseline than you were yesterday or the week before? So that's how we do all of the daily testings. And whenever we have someone who doesn't feel well, we give them the COVID test. If they were to test positive, then the whole building gets tested, the staff and residents. But if they feel fine, or if they come back negative, then it's fine. If someone were to be tested and come back positive, we would then shut down the building, the community, like we did before, and put our protocols in place to make sure we don't have any more positive transmission. Audience, I'll give you one last call to see who wants to write a question in. Terry, thank you for your excellent questions. Terry, and if you have any more, go ahead and type them in now. We'll give them a few minutes. In the meantime, residents, my panel members, does anyone else want to share anything? All right, you all have been fantastic. I think what I'll do is just we'll give them one more minute. And while we do that, I'm going to share something up from my screen. And that is, again, if you want to connect with me by phone, you can call or by email. If you are in the audience and you have questions later, feel free to reach out to me and I will make sure that I get your question answered by a resident, okay? But in the meantime, I just want to say thank you so much to our audience members for listening and joining us today. I hope this webinar was educational and inspirational to you. And I want to thank our fantastic panel members for your honest and enlightening answers. Again, if you have any other questions about COVID and how Ida Culver House Ravenna has managed COVID, or if you have questions about yourself possibly moving into Ida Culver House Ravenna, please reach out to me. And either I or my associate will help you out and answer your questions. All right, let's see if we have any chats. Stephanie, do we have any more questions on the chat?
We have one more question.
Wonderful. What is,
How long was Ida Culver House Ravenna shut down? Or how long is it going to be shut down?
yes, how long did COVID shut down Ida Culver House Ravenna? Panelists, who would like to answer that one?
This is Mary. I can answer that a little bit.
Wonderful, Mary, thank you.
We shut down kind of in the middle of March, I think the second week of March. And other than very, very limited walks in the garden, it was really about 7 or 8 weeks. Does that sound right to everybody? And then it just gradually got a little bit better. But being able to go outside, originally we were one by one escorted into the garden for 10 minutes a week or something like that. And then that gradually increased to a couple times a week. And then now it's almost every day you can go out in the garden. And like I said earlier, after a couple of months, I talked to the director about going off site for my walks and being able out to drive, and she was fine with that by that point. So pretty much 7 or 8 weeks, give or take, where it was really shut down. And now we're just gradually opening up, and they're going by the governor's guidelines and CDC guidelines. I mean, they aren't making this up. It's all science-based, shall we say, about how to keep us safe, but still give us more leash.
Thank you, Mary. Does anyone else want to answer that question about how long we were shut down in place? Okay, excellent. Terry, that's a great question too. And again, we were like seriously shut down for about 2 months. And then as we learned, for Era Living, we have a very close relationship with the University of Washington, but we also have a close relationship with the governor's office. And so when we would receive word from the governor's office, Era Living would take about 2 weeks to really test our protocol and how we were going to roll it out to all 8 communities. So we didn't just react to what the governor was saying. We were, okay, the governor said we can open up. What does that look like for us? So that our number one reason that Era Living exists is to give older folks who want to have a good lifestyle the dignity of having a good lifestyle. And so that also means that we are fully committed to the health and well-being of every single one of our residents. When we have had viruses such as the blue eye virus or the norovirus come through our communities, we have done the same thing. We have asked people to stay in their apartments, continuously wash their hands, and stay as safe and isolated as possible until we could get the virus under control. With the novel coronavirus, we didn't know how long this was going to last. I don't think anyone knew that we were going to still be talking about it in 6 months. But I'm very impressed with how Era Living partnered with the University of Washington to navigate this virus and to keep us all safe. And they have done a fantastic job. We have 1 minute left. Audience members, do you have any other questions before we sign off? We want to respect your 1 hour of time that you've given us.
Hi, this is Judy. I just want to say thanks very much to everyone.
You.
Very informative.
Well, good. Thank you so much.
Thank you.
Thank you. Anyone else? All right, everyone, thank you so very much for your time today. Panelists, thank you for your honesty, and our audience members, thank you for listening in and hearing our stories. Everyone, have a wonderful rest of your day. Take care.
Thank you.
Bye-bye.
Bye-bye.